Greetings, everyone, and welcome back to the Deep Dive.
Great to be here.
This is where we really try to unpack some complex professional knowledge, take these interesting sources, and hopefully turn them into insights you can actually use.
And today we've got a really fascinating mission, I think. We're diving into something that honestly sounds like a contradiction, right at the heart of anterior aesthetics.
Yeah. What's that?
Well, it's the secret power of asymmetry.
Yeah.
We all learn the classical rule, front teeth, they got to be perfectly
The
symmetric.
Da Vinci standard, yeah.
Exactly. But what the research and honestly clinical experience shows is that a little bit of imperfection, a slight asymmetry, it's not just tolerated. Sometimes it's actually necessary.
Necessary. How so? For stability or just looks?
Both, actually. Stability mechanics and, even just looking natural.
Okay, so that's our deep dive today. We're going to be crossing disciplines, it sounds like. Starting with what? Pure mechanics?
Yep, force mechanics first. Then we'll get into a bit of design philosophy, believe it or not.
Philosophy. Interesting.
Yeah. And then finally, we land on the hard science. The physiology of how your own eyes work, specifically your eye muscles, and how that limits what you can even perceive.
Right. So the goal here is to really empower you, whether you're practicing dentistry or maybe you're just curious about, what makes a smile beautiful. We want to get beyond just the what you should do and really explain the why.
The fundamental why behind those tolerance limits.
Yeah.
Why does a tiny difference here completely wreck the look? Well, maybe a much bigger difference over there is totally fine. It feels like a paradox.
And that's the paradox we're going to try and solve today.
Let's do it.
Okay, so let's start right where the rubber meets the road, like you said, the technical stuff, fixed prosthetics. When a dentist is prepping a tooth, say for a crown, especially those lateral incisors, the ones next to the big front teeth.
Right.
How you shape that biting edge, the incisal edge, apparently that dictates everything. Long-term success, how it looks right away.
It really does. I mean, the sources we looked at really hammer on a very specific requirement for the cross-section of that edge. It's not just, make it straight or give it a bevel.
Yep.
No. You actually need to create two parallel S segments. Think like a very, very shallow wave shape in cross-section.
Two parallel S segments. Okay, that's specific. Why S-shaped and why parallel?
Well, the S shape gives it some contour, some natural form. But the parallel part, that's the critical instruction. That's the mechanical key.
And what are you trying to avoid? What's the big no-no?
The big no-no is a steep sloping angle, or like a sharp bevel that isn't parallel to how the opposing teeth meet it.
Ah, okay.
Making that edge parallel or not, that's a conscious decision. It's a choice, as the material puts it. And it completely dictates how forces get distributed onto that crown, onto that restoration.
Right, so we're talking forces now. If you do it right, maintain that parallel, maybe slightly curved S shape. What kind of force do you get?
You get what the sources call focused force. The term they used was Joule. Think of it like stable, compressive strength.
Compressive, like pushing straight down.
Exactly. Imagine two perfectly flat, parallel surfaces coming together. The force goes straight down, evenly distributed. It pushes the crown into its most stable seat on the prepared tooth.
And that's good because?
Because it's stable. It protects the tooth underneath, protects the cement, makes the porcelain less likely to chip. It lasts longer. Focus force is predictable, controllable.
Makes perfect sense. Engineering 101 almost.
Pretty much.
So conversely, if you mess up and introduce that steep slope, that non-parallel angle, the thing you're told to avoid, what happens then?
Then you immediately get scattered force, mise-en-scène. And scattered force is bad news.
How so?
Instead of just compressing, it acts like a wedge. It introduces sideways forces, lateral components, shearing forces, tipping forces.
Like trying to pry the crown off.
Exactly. Those scattered forces, they're just detrimental. They pop cement seals, they cause fractures, and eventually it looks bad too, because the crown is constantly being nudged out of position.
Okay, so stability equals good aesthetics in the long run. But how does this link directly to seeing an imperfection, like right away?
It connects through this idea. The source is called the danger of combining defects. They talk about two main types of alignment issues you might see up front. First one is simple, an elevation difference. Gaudicha. One tooth is just a little bit higher or lower than its neighbor.
Like a tiny step. What does that do mechanically?
Well, it does cause a mild scattering of force because the contact isn't perfectly aligned. But visually, a slight height difference. The eye often lets it slide. It's a gentle deviation, just one variable that's slightly off.
Okay, one variable often tolerated, but the real danger zone is when you combine that height difference with the second defect.
Which is?
The pronounced slope or tilt. The very thing we just said causes major scattered forces.
Precisely. So imagine the tooth is already a little high or low. That's one issue, a mild instability. If you then add a steep slope or tilt to its incisal edge during the prep,
Uh-oh.
you're compounding the problem. You've got the mild scatter from the height difference, plus the massive scatter and shear forces from the slope. And visually, that combination is killer.
That's when it becomes immediately obvious.
Instantly. The rule is, if you already have that mild scatter from a height difference, adding a significant angle makes the aesthetic flaw jump out. It becomes glaringly obvious.
This is where that great phrase from the source comes in. It makes the defect Yuzichulai.
Yeah, basically the pomelo pops out. It just means it stands out right away. You can't miss it.
Like a sore thumb.
Exactly. It's like the visual system just goes, whoa, too many things wrong here. Height and angle.
Okay.
That looks structurally unsound even if the actual dimensions are tiny. The combination pushes it over the edge of what we perceive as acceptable.
So the core message, mechanically and visually, is keep those edges flat, meaning parallel wherever you possibly can. Maintain that focused force.
Right. And if you inherit a situation with a slight height difference, for goodness sake, don't make it worse by adding a slope. Keep it parallel. #tag 3, midline shifts, and the rule of the single variable.
Okay, that mechanical groundwork, keeping things parallel to avoid scattered forces, that sets us up really nicely for this next idea, the aesthetic tolerance principle. It seems like the same logic applies beyond just the biting edge, right? Like when we talk about the midline, the center point of the smile.
That's exactly right. It's still about how complex the deviation is, how many things are wrong at the same time.
Okay.
So the sources break down potential midline problems into 3 basic scenarios to make this point.
Scenario 1.
Pure parallel shift. Simple. The whole midline, maybe the 2 front teeth together, just shifts sideways, left or right. But crucially, the teeth themselves stay perfectly upright relative to that new shifted position.
Got it. Like sliding the whole unit over. Scenario 2.
Parallel shift plus tilt. So the whole unit slides sideways again. But this time, the teeth are also tilted or angled relative to that shifted midline.
Okay, so 2 things wrong. Shifted and tilted.
Right, and scenario 3.
In situ tilt, meaning in place. So the midline location is correct, dead center.
Yep.
But the central incisors themselves are tilted or angled right there in the correct spot.
Perfect. Okay, now here's the pop quiz. Which of those 3 looks the most weird or unnatural to the human eye? Which one is easiest to spot as just wrong?
My gut might say the biggest tilt, so maybe number 3, the in situ tilt, if it's severe, or number 2, because it has 2 problems.
Good guess. But the answer, according to the principles driving aesthetics, is clearly number 2. The parallel shift plus tilt.
The one with 2 problems.
Yes. And this leads us to maybe one of the most powerful takeaways from all this. Only allow one variable change at a time.
The single variable rule.
That's the golden rule for aesthetic tolerance. Think about it. A pure parallel shift, that's just one variable changing the horizontal position. If it's a small shift, the brain can often kind of adapt. All the internal relationships, the angles, the relative heights, they're still correct. You've just moved the whole frame.
Okay, tolerable.
But the second you add that second variable, the tilt on top of the shift.
The brain has to process 2 different kinds of wrongness at once.
Exactly. The cognitive load just shoots up. Your brain isn't just seeing a shifted tooth or a tilted tooth. It's seeing a relationship that's broken in 2 independent ways.
It's like if a picture is hanging crooked, that's one thing. But if it's crooked and the frame itself is warped.
Perfect analogy.
Yeah.
The whole thing just looks fundamentally off, jarring even. It screams mistake. Same with teeth.
So bringing this back to the clinic, if a patient comes in and they already have, say, a minor height difference between 2 teeth, which we said is a gentle single variable, the absolute key thing for the dentist doing restorative work is don't introduce another variable.
Do not introduce a second variable. Avoid it like the plague. Don't add a significant tilt. Don't mess with the rotation if you can help it.
Because that's what tips it over the edge.
That's the core principle of aesthetic correction. If you can fix the single existing variable, great. If you can't fully fix it, you must be incredibly disciplined not to add another problem on top.
Because that combination moves it from maybe subtle natural variation
straight into obvious jarring flaw. It's the combination that our visual system just flags as unacceptable.
Wow, that single versus multivariable idea. It explains so much about those cases where, technically everything seems okay, the shade matches, the margins are good, but it just feels wrong.
It's often because there's more than one subtle deviation happening at once.
Okay, so we've got mechanics keep it parallel, and the cognitive rules stick to one variable. Now, let's tackle that big paradox you mentioned at the start.
Yes, the philosophical battle.
The historical dominance of perfect symmetry in Western art and aesthetics. Da Vinci, Michelangelo. The rule was absolute symmetry is mandatory.
Right. And in that kind of thinking, very linear, almost one-dimensional, symmetry and asymmetry are opposites. They can't coexist. If you need symmetry, asymmetry is just wrong. Impossible.
And dentistry, for a long time, felt that pressure to achieve perfect mirror images.
Absolutely. The old school thought was pretty rigid. You must be symmetrical. Full stop.
But reality bites, right? Patients aren't perfectly symmetrical. Clinical situations are complex.
Always. And this led to that breakthrough moment you mentioned around 1994, when the textbooks themselves started saying something contradictory.
What was the statement?
It was basically, you must strive for symmetry.
Yes, right.
BT, and this is the kicker, slight asymmetry is permitted.
Okay, hold on. That is a paradox. Rule A is mandatory, but also it's okay to break Rule A a little bit. How does that even work? How do they bridge that gap from it's either symmetrical or it's wrong to something more nuanced?
Well, it required moving beyond that rigid 1D logic. It needed sort of a philosophical upgrade. And the sources point towards a way of thinking found in traditional Chinese philosophy, actually. This concept of seeking common ground in diversity, seeking diversity in common ground.
Okay, translate that into teeth for us.
Let's try. Think structurally. The common ground, the tong, is the overall design principle. The face is generally symmetrical. The smile needs balance. The teeth relate to the horizontal plane. The big picture requires symmetry. That's the common ground.
Okay, the baseline is symmetry, and the diversity, the yi.
That's the small, allowable deviations within that symmetric framework. We're seeking a little diversity inside the common ground.
Oh, okay.
Like the analogy they use. Imagine you have a bunch of sticks, all exactly the same length. That's the common ground. But you make them different colors. That's the diversity. Length is the same, color varies. Or flip it. Same color, common ground. Slightly different lengths, diversity. Both aspects exist together without breaking the overall pattern.
I see. So you maintain the main rule, but allow minor variations. How does this apply to the front teeth specifically?
It applies through a clear hierarchy. This is often called Lombardi's principle of dominance. It dictates how much diversity or asymmetry is allowed for which teeth.
A hierarchy of tolerance?
Exactly. It solves the paradox because the main rule symmetry is only strictly enforced at the top of the hierarchy.
And the top, the most dominant, the protagonist of the smile. That has to be the central incisors, the two big front teeth.
Absolutely. Zhengmen Ya. They demand the closest possible adherence to perfect symmetry. If something's obviously wrong there, the whole smile composition kind of falls apart. They are the star players.
Okay, centrals need to be twins. What about moving outwards, the lateral incisors, the ones next door?
Semen Ya. These are the supporting roles. Pejua. Here, the rules relax significantly. The tolerance for asymmetry goes way up.
So a slight difference in their length or shape or angle, that's okay?
It's more than okay. It's often desirable. It's part of that diversity within common ground. It's what makes the smile look natural, not like a perfectly artificial denture look.
Interesting. So we're allowed asymmetry there, and then the canines, the corner teeth.
Quan-Chi. Yeah. They have the greatest tolerance. They're really on the visual periphery of that main aesthetic zone. They can be quite different in size, shape, angle, and it usually doesn't disrupt the overall sense of balance or symmetry.
Wow. So central incisors, strict symmetry, lateral incisors. Some asymmetry allowed, even good. Canines. Lots of asymmetry tolerated.
That's the hierarchy. And it perfectly explains how you can have the rule be symmetrical, but also allow for asymmetry. It just depends where you are in the smile. Symmetry is the main theme, but variations are allowed in the supporting part.
Okay, that makes logical sense now. But it leads to the biggest question yet. Why? Why on earth can the lateral incisor, which is right smack next to the supercritical central incisor, tolerate so much difference? They're neighbors.
And that why doesn't come from art or philosophy. It comes from biology.
Okay, this is the part that really blew my mind when we were reviewing the sources, the final piece. The reason for this whole hierarchy, this tolerance difference, it's not aesthetics class, it's biology class.
It's pure physiology.
Yeah.
Apparently, the dental world wrestled with this for ages. Why are the laterals so forgiving when they're right next to the perfection-demanding centrals? The answer surfaced around, 98, 99?
Yeah.
And it came from, reportedly, an orthodontist, linking it all back to how our eyes physically work. the muscles and nerves that control them.
Our eye muscles, how do they limit our perception of symmetry?
Well, think about how human eyes are built compared to, say, other animals, like fish or a horse even.
Okay.
Their eyes can often move independently, look outwards. Divergence, it's called. They can sort of scan the periphery on both sides at once.
Right, looking left and right simultaneously.
They can't do that. Humans are built for binocular focused vision. We're really good at moving our eyes inward. That's convergence. Like when you focus on something close, you go a little cross-eyed.
Okay, yeah, I can make myself go cross-eyed.
Right. Try it now. Easy to look inward. Now, try to consciously look at something way over on your far left and simultaneously something way over on your far right without moving your head.
No, can't do it. My eyes either focus forward or converge inward. I can't make them diverge outwards independently.
Exactly. Our muscles just aren't built for conscious divergence. We focus forward or inward.
So if we can only really converge or look straight ahead easily, how does that impact judging symmetry across the front teeth, especially the ones further out?
It forces our brain to use a specific mechanism for judging things on the periphery, the scan and compare mechanism.
Scan and compare.
Yeah, because you can't easily hold both the right lateral incisor and the left lateral incisor in your sharp focus zone at the exact same instant.
Yeah.
They're too far apart for easy convergence.
Right.
Your brain can't do a direct side-by-side real-time comparison.
So what does it do instead?
It has to cheat. Your eyes perform a very rapid movement, a saccade.
Yeah.
You flick your gaze from, say, the right side over to the left side, look right, then instantly look left. Okay, quick scan.
And here's the crucial physiological part. Because that scan is so fast, when you look away from the right side, an after image, a residual image of that right side is held very briefly in your visual short-term memory, like for a fraction of a second.
Oh.
It's that fading residual image from the right side that your brain then compares against the fresh image it just picked up from the left side. That's the comparison process.
That is wild. So judging peripheral symmetry isn't instant. It's actually a time-delayed comparison using visual memory, like comparing a photo to a ghost image.
Pretty much. And if the scan isn't fast enough, or if you're not actively trying to compare, that residual image fades before the comparison can happen. You lose the ability to easily spot subtle differences out there.
Okay. Connect this back to the hierarchy.
Yeah.
Centrals, laterals, canines.
Easy. The central incisors, where are they? Right near the midline.
Yeah, front and center.
So they fall comfortably within your eye's natural zone of convergence or easy forward focus. You can practically see both at the same time without much effort, meaning you can do a near instantaneous comparison.
Exactly. Your eyes don't need the complex scan residual image compare trick for the centrals. The comparison is direct and easy. That's why symmetry there is critical. Any difference is immediately obvious, an at-a-glance flaw. They are the protagonists, demanding perfection because they're easy to scrutinize.
But moving outwards, the lateral incisors and the canines, they're further from the center.
They fall outside that easy convergence zone. To spot a difference between the right lateral and the left lateral, or the right canine and the left canine, the viewer must initiate that rapid scan and compare process.
They have to make an effort, consciously or subconsciously.
Yes. If someone is just casually looking at you, talking to you, their eyes probably aren't doing that specific rapid scan needed to compare the laterals or canines precisely. Detecting asymmetry out there requires a deliberate visual task.
And because it requires effort from the observer,
those areas inherently have a much higher tolerance for minor imperfections. The biological limitation of our eye movement actually shields peripheral asymmetry from easy detection.
So Lombardi's principle, the hierarchy of dominance, it's not some arbitrary artistic convention. It's literally an engineering outcome based on the limits of human eye muscles.
That's the insight. It just flips the whole thing. It's not about what looks nicest in an abstract sense. It's about what the average human visual system can actually detect easily versus what requires effort to notice.
That actually simplifies things immensely for a clinician, doesn't it? You know precisely where absolute perfection is non-negotiable, centrals, and where you have wiggle room for natural variation, laterals and canines.
It takes the guesswork out. You focus your absolute precision where the eye focuses easily. You allow for artistic interpretation where the eye itself provides a natural buffer. It aligns the clinical work with biological reality. #6, conclusion and outro.
Wow. Okay, that was quite a journey from, the very physical prep of a tooth edge through philosophy and logic.
Yeah. The single variable rule.
And landing squarely on how our eyeballs are wired. That's a really holistic understanding.
It really ties it all together, doesn't it? And hopefully it shows why true aesthetic success isn't just about one thing. You have to manage, like we said, 3 interdependent factors.
Recap them for us quickly.
Okay, first, mechanics. Keep those incisal edges parallel for focused force, for stability. That's foundational.
Right.
Second, logic, or maybe cognitive processing. Obey the rule of the single variable. Don't combine defects. Avoid making things complexly wrong.
Got it.
And third, physiology. Respect the hierarchy of tolerance dictated by eye muscle limits. Perfection is mandatory centrally, where comparison is easy. Diversity is permitted peripherally, where comparison requires effort.
And synthesizing those 3, that's where the clinical power lies. For you, the listener, whether you're actually designing smiles or just, appreciating them.
Wear your own smile.
Yeah. This knowledge lets you see past just the surface rules. You understand the why behind what makes a smile feel right, balanced, stable.
And you know where to demand precision versus where to embrace a little natural variation. It allows for beauty that respects perception.
Well, before we sign off on this deep dive, we always like to leave you with something to chew on, a final thought.
Okay.
So we've just established that asymmetry is tolerated more on the periphery laterals, canines, because our eyes have to actively scan and compare to even notice the difference there. It takes effort.
Right. The detection is impassive.
So the question is, how might this same physiological principle, the need for active scanning to detect peripheral difference, influence how we perceive other aesthetic elements of the face, or even clinical setups that are also further away from our central point of focus?
Interesting. Like what?
Well, maybe the overall curve of the smile arch compared to the horizontal plane. Or what about things we rarely think of in terms of strict symmetry, like ear position, cheekbone prominence?
Do areas further away from the nose and eyes, the central focus zone, also have sort of built-in biologically driven tolerance for asymmetry simply because they require more effort to compare side to side?
Something to think about. Does the scan and compare limitation apply more broadly than just the teeth?
A great question to ponder.
On that note, thank you so much for joining us for today's deep dive.
It was fun. Bye-bye.
Bye-bye.